I'm Ernest Podrasky. I'm a cardiologist at Core Cardiology here in Exeter, New Hampshire. I moved here approximately 4 years ago. I grew up in western Pennsylvania, coal mining country. Did my education undergrad at the University of Pennsylvania and then medical school in the University of Pittsburgh. Did my residency training in Pittsburgh as well, some research in San Francisco at the University of California, San Francisco. Then went on to do my cardiology training at Mount Sinai Medical Center in New York City. After that, I practiced for a few years in Kansas and worked my way back to the East Coast. One of the things that I think makes Exeter Hospital stand out and makes core physicians stand out is the wealth and breadth of services that we provide with regard to cardiac care. For a community this size and for a hospital this size, we really provide a level of care that is far beyond what is offered at the average community hospital. We offer a full range of cardiovascular services both in the office and in the hospital. We do diagnostic testing, both invasive and non-invasive imaging. We do echocardiography. We do stress testing, both with imaging and without imaging. We do nuclear imaging. And then in the hospital side, we do invasive testing as well, cardiac catheterization, and treatment procedures as well, such as angioplasty, stenting, both in the emergent and on an elective basis. Preventive care is something that's one of my particular areas of interest. When you look at healthcare expenditures per capita in our country, we spend more than double any other westernized nation does on healthcare. A great deal of that is spent on diagnostic testing and on procedures at or toward the end of life. And a lot of those procedures are done in the area of cardiology. Cardiovascular disease is the #1 killer of men and women in the United States, and it continues to be, despite all the advances that we've made over the years. What's heartbreaking to me is that the majority of these events could be prevented. The risk factors for cardiovascular disease have been well known for decades. We know that smoking doubles your risk of cardiovascular disease. We know that a high-fat, high-cholesterol diet and a sedentary lifestyle increase your risk of atherosclerosis and subsequent coronary disease and heart attack. We know that we can reverse these trends if people exercise, if people eat right, and if people stop smoking. When a patient's lifestyle or family history finally do catch up to them, and in some cases it's inevitable, people will present with an acute heart attack. One thing that we offer at Exeter Hospital through Core Physicians is 24/7 angioplasty. The idea of doing primary angioplasty or taking a patient to the cardiac catheterization lab in the setting of an acute heart attack is something that was really pioneered by physicians in our group in the community hospital setting. It's a program that we're very proud of, and proud of the involvement of our physicians, in particular Dr. Tom Wharton, in developing a program like that in a community hospital setting. Recent technology has developed involving cooling the patient, dropping the patient's body temperature. We use a device here at Exeter Hospital called the Arctic Sun. So if a patient suffers a cardiac arrest in the field, we can lower their body temperature significantly for 24 to 48 hours and preserve brain function and dramatically increase the likelihood of a meaningful recovery after a cardiac arrest. Another thing that we do is through our outreach and collaboration with other institutions in the region, we can offer other cutting-edge services that maybe are not available at Exeter Hospital, but through our collaborations we can offer services such as advanced electrophysiology testing and treatment and cardiac surgery referral to other regional hospitals where we actually have very good working relationships and very strong collaboration with physicians at those places. One of the things I love about my current practice is the people that I work with, both my patients and my colleagues. It's difficult as a physician, particularly as a young physician, to find people that you share philosophy with. And to find a group of people that care about patients the same way that you do isn't as easy as it would sound. Here at Core Cardiology, we really have a group of individuals that are really focused on patient care. I think all of my colleagues treat the patient as a whole person, trying to find treatments and procedures not that just address their diagnosis, but really treat the whole person, the whole individual as well.